So simple, the way you write alpha, you will get a green color. The way you write beta, you will get a Y, that is yellow color. And gamma is the same red color as before. So this is going to be your basic classification. What organisms come under it? So alpha has two things, and that is going to be VP. What is VP? That is Streptococcus viridans and Streptococcus pneumoniae. Streptococcus viridans and Streptococcus pneumoniae. Beta hemolysis has a further classification that I'm going to come to, and gamma has the very famous Enterococcus. So yes, what is the classification that I'm going to tell you about? For beta hemolysis, we have something called as the Lancefield classification. So why have I highlighted the C over here? Because the basis of the Lancefield classification is the C antigen, and on the basis of that there are 20 groups, that is A to V, but A to V does not make 20 alphabets because that does not have any I and J. That is how you get 20 groups, right? So for specially telling you for which category, for that beta, I'm writing beta and yellow together, okay? For that beta hemolytic wala category, we have a Lancefield classification which divides it from A to V. Out of that, the group A, so what will you call it? Group A, beta hemolytic streptococcus. Group B, beta hemolytic streptococcus. So let me give you some examples. What is going to come under group A? It is going to be Streptococcus pyogenes. What is going to come under group B? These are the two which I'm going to teach you. Group B is going to have Streptococcus agalacti. It is going to have agalacti. So remember, that is group A, beta hemolytic streptococcus. Group B, beta hemolytic streptococcus. This group A, only group A, can further be divided into two types, and that is known as a typing. So that is known as the Griffith typing, and that is known as the M typing, EMM. Okay? The Griffith typing and the M typing. So Griffith typing, I'm just telling you the introductory part right now. If you understand it well and good, nahi samajh aaya, you will understand it in 2 minutes. Where is all these alphabets coming from? So what is Griffith? Griffith type is based on, it is based on the M protein. There is a protein known as M protein on which the Griffith typing is based. I hope you all know every protein comes from a gene, na? So EMM typing is based on the M gene. It is based on M gene, as simple as that. So Griffith is based on M protein and EMM is based on M gene. And this is applicable only to group A. So repeating, Lancefield is applicable only to beta hemolytic, and under beta hemolytic, what is the classification? It is based on the C antigen. 20 groups from A to V, no I and J. A is divided into Griffith and M typing. If I try to correlate this way back in your immunology chapter, I hope you remember that I'll make a table over here so that maybe you can recall it later on. I hope you'll remember that Lancefield was done by what kind of a precipitant test? I hope you remember that was a ring precipitation test, or the ring precipitation reaction. I have taught you that there is going to be Lancefield grouping, but nowadays, as I said, nowadays no one does this ring precipitation test. Nowadays it is going to be done by latex agglutination test. So this is again something to correlate with your previous chapters, right? So Lancefield, simple word, Lancefield pehle karte the with ring precipitation. Now Lancefield LA is going to be done by LA, that is latex agglutination test. All of this is done. Can we move forward and start off with this one? Group A, beta hemolytic streptococcus is what I'm actually not going on to the other families. I'm starting with this wala family only because we've spoken so much about it. So let's start with the beta hemolysis. Under beta hemolysis, let's start with group A. And what do you want to call it? I just told you. Group A, beta hemolytic streptococcus is said to be Streptococcus pyogenes. And you know how we are going to study virulence factors, clinical features, diagnosis, treatment. So let's start with the virulence factors. Remember, it has a capsule which is non-antigenic, and that capsule is basically made up of hyaluronic acid. That capsule is made up of hyaluronic acid, and this hyaluronic acid has a property that this can cross react with what? Where do we have hyaluronic acid in our body? We have hyaluronic acid in the synovium. This can cross react with the synovium tissue or the synovial tissues of our body. So please remember, this is a little different because I have taught you all the capsules are made up of what? All the capsules are usually made up of polysaccharides. Now I am telling you that there is one capsule which is going to have hyaluronic acid in it, and that is Streptococcus pyogenes, right? Also, please remember this hyaluronic acid can actually break the connective tissue. That is again something very important. In fact, I'll tell you some enzymes also that can help in it. Abhi ke liye pad lo. But main point, capsule is going to have hyaluronic acid. Let's move on to the next antigenic or the virulence factor, and that is the cell wall. There are some cell wall antigens. And which antigen am I talking about? Of course, you know it's the C antigen, because C antigen is the basis of which grouping also? It's the basis of the Lancefield grouping. Apart from that, the cell wall also has some outer membrane proteins. Outer membrane proteins include MTR. There is M protein, T protein and R protein. And M, I think everyone is knowing that with the help of the M protein, I was doing the Griffith typing, which was very, very important. Now let me ask you a little bit. Have you studied how the M protein is also M for mimicry? I hope you all know that the M protein that you have in Streptococcus pyogenes is very, very similar to the glycoproteins that we humans have in our body. They are like twin brothers who have been separated. One is in a bacteria, one is in human, but they are twin brothers. They look exactly the same, and this is the reason that we end up damaging ourselves. This concept is known as molecular mimicry, and this is why we have diseases like rheumatic heart disease and so on. So in the pathogenesis of rheumatic heart disease, what you study is this, that the M protein of Streptococcus pyogenes is very similar to the glycoproteins of our heart. Or not only heart, of our joints, of our skin. That is when rheumatic heart disease, heart, joint, skin, everything is affected, right? Okay, what else? So capsule is done, cell wall is done. Now we go on to the enzymes and the toxins. I can see a lot of things. It has streptokinase. It has hyaluronidase. Now, what are the two things to do with this? Pehle, what is streptokinase? So, obviously, this has streptokinase, iska virulence factor hai. But how do I use? If someone asks you, what is the therapeutic use of streptokinase that we have? So, please note that streptokinase is gonna be a fibrinolytic agent. It causes fibrinolysis. It causes fibrinolysis. That is why I use it in so many cardiac patients. For cardiac patients where you want fibrinolysis and clot breakage to occur, you can use this. But the therapeutic use that you do is of Streptococcus equisimilis. That is not of Streptococcus pyogenes, and Streptococcus equisimilis is not a group A. Pyogenes is group A beta hemolytic, na? This is a group C beta hemolytic Streptococcus. It is a group C wala Streptococcus. That is equisimilis is going to be group C wala. From there we get this streptokinase and we use it in our fibrinolysis in the cardiac department. Next one, hyaluronidase. Of course, this is the one that I was telling you. Hyaluronic acid and hyaluronics are related. I told you this is the one that is going to break the connective tissue. So they ask you which of them is useful or which of them can break the connective tissue. That is a question. Coming to the next, it has DNase A, B, C, D. Firstly, DNase is the enzyme that is going to protect it against, I'll tell you something and maybe you've heard about it, nets. Where have you heard nets? Pathology, neutrophil extracellular traps. My body can have neutrophil extracellular traps and kill the bacteria. So what has the bacteria got? Bacteria has got DNA that if you try to kill me with nets, I have my protection. Out of these, please remember, the most important is DNase B, which you also study in a lot of conditions like kidney disorders. May you measure these levels in someone's blood. So DNase B is the most important. Then of course we have hemolysin or streptolysin. This I'm going to tell you in detail. We have something called SPE, which requires detail. And then this is, if you want to learn, you can learn serum opacity factor. Not very important. But ye jo do hai, hemolysin and SPE, we will do in detail. So what is hemolysin? Whether you call it hemolysin or you call it streptolysin, it means the same. And there are two types. Please note, there is something called SLO. So, of course, you know streptolysin O and streptolysin S. That is exactly what we are talking about. These are streptolysins or also known as hemolysin. So, streptolysin and hemolysin, SLS, SLO. So, kaise pada? How will we learn all this? Dekho, how does this look like? This looks like slow. If I try to read it, it looks like slow. So, can you read it opposite now? If I read it opposite direction, what does it become? So, if you read it in this direction, it was slow. And if I read it opposite, it becomes OLS. I have learnt it as OLSS. Ulta padna isko. Read it opposite. It will become OLSS because I will tell you it is oxygen labile. Bilkul, it is oxygen labile, and it is serum stable. Serum stable because we read slow, slow, steady, steady, stable, stable. If you're slow and stable, your preparation will be good. So slow, slow, stable, stable. Matlab, it is going to be oxygen labile and it is serum stable. Does it become simple? So if this is SLO is oxygen labile, labile means weak, so SLS becomes oxygen stable. Similarly, if this is serum stable, this is going to be, other one is going to be serum soluble. So simple, SS slow ko ulta pado, oxygen labile, serum stable. What is the property? This slow wala, as I said, na, slow and steady will win the race. This is the one that is antigenic. This is the one that is LCL. LCL matlab, it is lethal, it is cardiotoxic, it is leukocidal. Lethal, cardiotoxic, leukocidal. The SLS is only leukocidal, lethal nahi hai. Like I said, which is going to win the race? Kaun sa antigenic hoga, kaun sa lethal, cardiotoxic, leukocidal? Slow and steady will win the race. So slow wala can do all of this. So now tell me, if I say slow is the antigenic one and SLS is non-antigenic, so antibodies kiska hoga? That is why do we study that we always have anti-streptolysine O antibody titers. You always measure ASO titers, anti-slow, anti-streptolysine O, because that would be antigen. That is why these are the antibodies that I make. Also, it is LCL, lethal, cardiotoxic, leukocidal. Finally, the hemolysis. Both of them do hemolysis. This does hemolysis deeper into the plate. This does hemolysis on the surface of the plate. Ma'am, how will I learn this? So, dekho, dhyan se suno. Which of them was scared of oxygen? Oxygen labile means if you have surface with oxygen hoga na. If, for example, guys, this is your blood agar. Just as an example, this is your blood agar. So, will the surface have oxygen? Of course. This surface will have oxygen. So, will this be able to grow on the surface? No. This is oxygen labile. It will not be able to grow on the surface, but beneath, piche, where oxygen is not there, deeper, there it will carry out its activity. There it will do hemolysis. On the other hand, SLS, that was oxygen stable. That was oxygen stable. It means, will it be able to cause hemolysis on the surface where there is oxygen? Yes, it will be able to cause. Everyone's got the concept that this is oxygen labile, a little scared of oxygen. So on the surface, it will not cause hemolysis. Deeper, it is going to cause hemolysis. That is what you have to know regarding the streptolysins or the hemolysins. I hope everyone's settled with this, because now I'm going to ask you the next one, that is SPE. This is the next one that you have to know. See, streptococcal pyrogenic exotoxin. Streptococcal understood. Pyrogenic, kuch fever hoga. And this is an exotoxin, A, B and C. Let me tell you, out of them, A and C, basically, isme yaad rakho, this is a question. I wouldn't have told you that much of detail, but a question has come. Basically, B is not for B. If they ask you which of these is bacteriophage coded, you will say B is not bacteriophage coded. A and C are going to be bacteriophage coded. And B, jo bacha, B is not for B. So, A and C are bacteriophage coded. B1 is going to be chromosomally mediated. That is a chromosomal mediated. So, simple way that I have learnt is B is not going to be B. That is not bacteriophage mediated. What did I call it? Streptococcal pyrogenic exotoxin. Kuch pyrogenic hoga, to all fever wala things are going to come up. Scarlet fever, guys, how does a patient of scarlet fever present? Toxic shock syndrome, necrotizing fasciitis. We all know these. We're going to study them in detail. So remember, scarlet fever, toxic shock syndrome, which I also taught you. Toxic shock syndrome can be because of Staph aureus also. It can be because of Streptococcus also. Now you guys are going to tell me the toxins. Staphylococcus aureus ka toxic shock syndrome toxin. Streptococcus ka SPE is what I'm telling you. This can also cause necrotizing fasciitis. So now when I'm telling you your virulence factors are done, why don't I tell you all the clinical features also? There are some suppurative clinical features and non-suppurative clinical features. For the suppurative clinical features, we have a mnemonic called nipples. So nipples matlab N is going to be for necrotizing fasciitis. The N is, we just studied, it is going to be for necrotizing fasciitis. I is going to be impetigo. I is going to be impetigo. P is going to be, of course, for pneumonia. But I'm forgetting one very important P, and that is pharyngitis, because we all know that Streptococcus causes pharyngitis. Okay. Then we have L, that is going to be lymphangitis. There is going to be lymphatic involvement also, lymphangitis. E is going to be for erysipelas. E is going to be for erysipelas. I hope you know what is erysipelas. If not, I will tell you. S is for Streptococcus can also cause toxic shock syndrome. So, Streptococcal toxic shock syndrome. And I just told you, scarlet fever. So out of these, I want to tell you a few things in a little detail. Then I'll go to the other variety. Out of these, we have to know what is this pharyngitis that it causes, what is erysipelas, and what is scarlet fever. In pe alag se question aega. So first, let me show you the pharyngitis. All of you can see that whitish exudate that has occurred on the tonsillar area and the soft palate. So this is gonna be a painful throat pain is gonna occur, and the lymph nodes involved are also gonna be painful. There's going to be pain in the throat, there is going to be pain in the lymph nodes, and usually of course throat ka hai to cervical lymph nodes hoga. But what is important is that this pharyngitis usually doesn't have cough. The treatment is with the beta lactams, that is penicillin, and treatment I'll teach you in a while. Okay? So simple, there's pain in the throat, there is pain in the lymph node, there is no cough, that is pharyngitis. What else did I tell you? We'll study erysipelas. This is what erysipelas looks like. So erysipelas is very, very red. You will say, ma'am, clinically, medicine mein, dermatology mein, I have read cellulitis is also that reddish pinkish color only. So this is also red, erysipelas, and that is also going to be some reddish pinkish. What is the difference? दोनों red हैं, बहुत ज़्यादा ऐसा painful जैसा लग रहा है, correct? दोनों painful भी हैं, red भी हैं and painful भी हैं. But what is the difference? If you look at erysipelas, they are looking, although I cannot, if you ever palpate a patient, you will see that they are looking above the surface, they are looking raised. And there's a proper demarcation that I can do. They are raised and demarcated. Remember, they are going to be raised and well demarcated, whereas cellulitis is, you cannot make any lines. It's all diffuse. It's all diffuse. It's not demarcated, not at all demarcated, and it is not raised. It is the same surface. That is how you have to know. So remember, erysipelas is going to be R for red and R for Rona. So there is going to be R for red, R for Rona, matlab it's going to be painful, R for raised. It is going to be R for raised, and I have learned R for round because proper shape banega. It is going to be well demarcated. So that is how you study it. You should be studying it in dermatology also. It is going to be R for red, it is going to be R for round, it is going to be R for raised, and it is going to be R for Rona, means very, very painful. Okay, red and Rona is going to be over here also, but cellulitis is not well demarcated and it is not raised. Simple. Now remember, erysipelas, when R was given so much of importance, I studied that the E is feeling left out. The superficial skin, superficial epidermis, dermis, superficial skin is affected, whereas cellulitis mein deeper dermis is going to get affected. Simple, sorted for everyone. So erysipelas ka to beautiful mnemonic we have ended up making na. So epidermis, dermis wala matlab superficial layer, and red, round, raised, Rona. Cellulitis is ulta. Now what am I left with? We also have to study what is scarlet fever. For scarlet fever, I've got you a mnemonic which will help you a lot in pediatrics also. So S is going to be of course sore throat, because streptococcus hai to sore throat to hoga, and I can see that sore throat and the hyperemic lesion over there. Okay, then circumoral pallor. There is a circumoral pallor that is there. These patients, in that, this is just a way of learning, they show you something called Pastia lines. Pastia lines are usually seen where jahan bhi folds hoga, like over here your body is folding, in the axilla the body is folding, in the groin, wherever in the neck, wherever the body has folds, like antecubital fossa mein there's a fold na, over there you'll see rash is more, that is known as Pastia line. So A for antecubital fossa, and of course I'm talking about rash. You can see the rash over here. Can you all appreciate? This is a sandpaper rash. That is how you define it, sandpaper rash. Okay, of course, whenever there is an infection, lymphadenopathy to hoga. These patients are also going to have a problem. I just told you which toxin. Scarlet fever, the streptococcal pyrogenic toxin, or the erythrogenic or the pyrogenic toxin that we have, SPE, ABC. And finally, the T is going to be for the tongue, because we all know that the tongue shows the very, very famous appearance, that is strawberry tongue. Yes, along with that, it is scarlet fever. So that is the mnemonic. That is which will help you in medicine and in pediatrics. Sore throat, circumoral pallor, antecubital fossa mein Pastia lines. There is rash, which is sandpaper rash. These words are very important. Lymphadenopathy, erythrogenic toxin, and there is tongue mein strawberry tongue. Very important words. Okay, so that finishes off all your suppurative lesions. What is non-suppurative lesion? Kidney mein we all know there's going to be PSGN. And heart may we all know there is rheumatic heart disease. These are all caused by Streptococcus pyogenes. And please remember, there is also a condition under non-suppurative which is known as PANDAS. Now, what is PANDAS? PANDAS refers to, it is actually a kind of, you can say it's a neuropsychiatric problem. And many people don't like to learn the full form. I'll tell you the full form, then I'll tell you the short form. It is pediatric autoimmune neuropsychiatric disorder. It is pediatric autoimmune neuropsychiatric disorder associated with what? Associated with streptococcus. It's something like someone saw there's a sentence and uska ek mnemonic bana diya, right? So it's a pediatric autoimmune neuropsychiatric disorder which is associated with streptococcus. You don't want to learn the full form, itna yaad rakh lo, it's pediatric, it is autoimmune in etiology, neuropsychiatric, usually patients have OCD. And S will tell you streptococcus hai. So tuta puta also if you learn it will work, okay? बच्चों में है, autoimmune है, neuropsychiatric है and streptococcus से related है. So remember nipples and pandas. Nipples and pandas becomes your mnemonic for streptococcus clinical features, because now we are moving on to the diagnostic part. What do you see? Streptococcus pyogenes. What do I see over here? In fact, any streptococcus, it's gonna be present in chains. Before this, we did staphylococcus. Staphyle was what? Grapes. This is gonna be present as gram-positive cocci in chain, and that is why it's looking all purple, na? Because gram-positive cocci have to be purple, and they are all back-to-back present in chains. Now you say that I collected a sample. I'll say, okay, what will you transport the sample in? For transportation, we have the Pike's media. For transportation of Streptococcus pyogenes, we have the Pike's media. Then what is the blood agar showing you? I see a blood agar over here. Please note, we have what kind of colonies? We have pinpoint colonies with a lot of hemolysis around it, wide zone. We call it the famous pinpoint colonies, and there's a lot of hemolysis that is happening around it. It is a wide zone hemolysis that I'm seeing. This is the blood agar finding. What is the selective media? We have the PNF media, which is made of antibiotics. CVBA, this full form you have to know. It's BA matlab blood agar, but there's something special to it. It is a crystal violet blood agar. It is a crystal violet blood agar. What does it show on liquid media? Granular turbidity. Ma'am, itna kuch ho raha hai, I will not be able to learn. So, let's go for a mnemonic. When I say Streptococcus pyogenes, everything is gonna be pi, Y. I'll tell you how. So, dekho, if I say Streptococcus pyogenes, and what is the media that it's gonna have, you will say the transport media is Pike's media. So, pyogenes mein Pike's media. What kind of colonies does it have? Pine point colonies. How much of hemolysis? Narrow or wide zone? Wide zone. So, remember now you have your mnemonic pi, Y. Pyogenes, Pike's media, pine point colonies, wide zone of hemolysis. Ho gaya ye yaad? Yes. Now, what is the mnemonic for selective media? Again, I will want you to write the same thing, Streptococcus pyogenes, because that will tell you P for what? P for PNF media. Y, V, same sound karta hai. Y and V, same sound karta hai. So that is the crystal violet blood agar that you have to know. And then in that O, we are going to make dot, because there is granular turbidity that you see on a liquid media. So ban gaya mnemonic. So P is going to be for PNF media. Let's do a recap. P is going to be for the PNF media. V, Y, crystal violet blood agar. And O mein dot, there's granular turbidity. So selective media are also done. Now we come to biochemical test. Again, you will write Streptococcus pyogenes over here. Everywhere you're writing Streptococcus pyogenes, because this will tell you that it is PYR test positive. It is PYR test positive. And is it sensitive to bacitracin or not? Yes, it is sensitive to bacitracin. So S for sensitive, PY for PYR test positive, and this I already know कि ये catalase oxidase तो कुछ नहीं है, वो सब catalase is all staphylococcus का story. This is nothing to do with catalase oxidase. इसका test you will remember bacitracin sensitive and PYR test positive. So all your mnemonics are on one slide, and I'm going to revise it with you. Streptococcus pyogenes, Pike media, pine point colonies, wide zone of hemolysis, pi, Y. Streptococcus pyogenes, PNF media, crystal violet blood agar, granular turbidity. Selective media done. Streptococcus pyogenes, PYR test positive, bacitracin sensitive. How in one slide you finish Streptococcus? Clinical features padna hai. Remember nipples and pandas? That is done. Let's go on to the treatment. As I said, the treatment is going to be penicillin, and in case of resistance, erythromycin can be considered. So guys, group A beta hemolytic streptococcus is done. Now I go to the next one. I go to group B beta hemolytic streptococcus, and that is going to be Streptococcus agalacti. I'll teach you, and then I have a nice mnemonic for this also. Streptococcus agalacti basically can affect neonates, and neonates maybe I have taken up the first 1 week of life. And then after 1 week to 3 months, that is the next set of children we've taken. So chote wale bacche who are less than 1 week, they are affected by odd numbers, serotypes 1, 3 and 5. Whereas older children who are up till 3 months, वो third serotype से होते हैं. तो remember, जो first week में odd number first week में होगा, that is odd numbers 1, 3 and 5 serotype. So 1, 3, 5. Whereas up till 3 months, third serotype is going to work. And what are the problems that they have? They have meningitis, pneumonia, septicemias. That is what Streptococcus agalacti causes. So you're definitely going to get some kind of a neonate with meningitis or pneumonia or sepsis. But that can happen because of so many things. Na? Hemophilus can also cause meningitis. Fungus can also cause meningitis. So ye jab aayega, what is it in the diagnostic, in the microbiome that they're going to tell me? So remember, time for some hip hip hooray. What is hip hip hooray? So group B beta hemolytic streptococcus, which is Streptococcus agalacti, which I'm calling as gala. Okay, agalacti is gala time. So it's time to have a gala time. Okay, gala time where? So gala time, we are going camping. Hip hip hooray. That is what how you learn it. Hip hip hooray. You're gonna have a gala time in the camp. So when I say gala, you obviously know that we are talking about agalacti. Very good. When I say camp, there is a test which I'm going to show you called camp test positive. When I say hip hip, this means there is going to be hippurate hydrolysis positive. And when I say hip hip hooray, that hooray we always pay emphasis on. It is resistant to bacitracin or sensitive. It is bacitracin resistant. And what color pigment can it have? It can have a red or an orange color pigment. On which media? On the Islam media. So everyone please first learn all these things that I have taught you over here. First finish off all of this with me so that we can go ahead and study all the details about it. So jaldi se revise karte hain. When I say gala, we are gonna say they are gonna have a gala time. So agalacti. When I put it up as camp matlab it is going to be camp test positive. Hip hip matlab hippurate hydrolysis positive. And hooray matlab R for bacitracin resistant and orange red pigment of an Islam media. That is the story of Streptococcus agalacti. You are done. You just now have to know two things. What is this camp test that I've mentioned and what is the treatment? So treatment to khatam karo. The drug of choice is again going to be the beta lactams like you've been doing till now everywhere. But what is this camp test? Firstly, if you want to know what is camp test, it is Christie Atkins Munch Peterson. Okay, it is Christie Atkins Munch Peterson. That is what is referred to as the camp test. Now, what am I seeing over here? I can see a blood agar in front of me. On this blood agar, I see that I have a line over here and a line over here. So, जो longitudinal line है, that is going to be of Staph aureus. Always remember. And did I tell you Staph aureus is hemolytic? Of course, Staph aureus is hemolysis. Beta hemolysis karata hai. Remember? Okay. And perpendicular, I have taken a sample from the patient. Maybe meningitis ka sample hai ya fir pneumonia ka sample hai. Whatever sample is there, and I'm assuming Streptococcus agalacti hai. So see, Streptococcus agalacti is also beta hemolytic. Staph aureus is also hemolytic. When one hemolytic person will meet another hemolytic person, what is going to happen? When both of them meet, there is enhanced hemolysis. So there is an area of enhanced hemolysis that is going to occur known as the arrowhead location. That is the arrowhead that is going to occur. That is enhanced hemolysis that you all have to know. So whenever two, khoob jamega rang, when that kind of a thing. So when two similar people meet, there is a lot of fun. There's more and more of fun that is going to happen. So more and more of hemolysis will happen because both of them start acting together. Yes, I hope everyone's okay. That is the camp test with hippurate hydrolysis, bacitracin resistance, red color, gala time in the camp, hip hip hooray is how you're going to learn it. So you're done with all the beta hemolytic. Group A is done, group B is done, beta hemolytic story done. I am moving on to the alpha hemolytic story. Guys, what were the two organisms coming under alpha hemolytic? Streptococcus viridans and Streptococcus pneumoniae. Now let me tell you that VP, as soon as I say VP, you will say, oh ma'am, this is reminding me of some vice president of some big firm. तो वाइस प्रेसिडेंट को अब क्या करना होगा? वाइस प्रेसिडेंट अब wants to become president and wants to become the CEO of the company and wants to become the owner of the company. So what will he do? He will give his biodata. He will give his biodata further. And you all know, like Forget vice president. Let's talk in doctor's language. For example, if you are first year resident, abhi all of you are gonna clear this exam, forget all microbio, you're gonna go on your path of residency. What will you do? Will you ever take panga from your HOD? Nahi na. You have to do thesis, you have to do everything, pass hona hai. So you're gonna, whenever your HOD gives you any work, you will have to say yes. Whether that work is making tea or whether that work is taking care of a patient, you will have to say yes to everything. And if you say yes to everything that your HOD says, you're going to have a very comfortable life in the department. So if you want, listen to the story first. If you want a license that you should be playing all games like carom and ludo and all games you should get to play, तो कैसे मिलेगा ये license? When you will say yes, yes, yes. Means when you will say yes, yes, yes to everything in the department, then you will get a license and you will be able to play games and chill in life in your department. मतलब this Streptococcus pneumonia जो VP बना, VP for P for pneumonia, this decided that I want a license. License means what is the shape of it? It is lens shaped. It is lanceolate shape. How did it get a license? For what? Can you see what colonies does it have? It has the very, very famous carom coin colonies. These are said to be the very, very famous carom coin, also given another name called Draughtsman. All these pictures I'll show you in a while again. Abhi I'm giving you an introduction. They are going to get a carom coin or a Draughtsman colony. So you'll say, fine ma'am, how will I get a license to play carom in my department? I will say whatever your HOD says na yes karna. If your HOD says ke biodata mein, if your HOD says bile solubility karoge, you will say yes. If he says inulin fermentation karoge, you will say yes. If you say optochin sensitivity show karoge, you will say yes. So whenever you say yes, yes, yes to everything in your biodata, that is biodata, bile solubility, inulin fermentation, optochin. If you say yes, yes, yes to everything, you will get the license to play carom, right? That is the story of Streptococcus pneumoniae. I'll come to that in a while. What is the story of Streptococcus viridans? A viridans, bichara viridans, very, 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 very resistant. It said, I will not say yes, yes, yes to anything. So, bas, you will not get to play carom in your department. So now you will be standing in a line with everyone. You are present as chains because you said that I will not show bile solubility. I will not show inulin fermentation. I will not show optochin sensitivity. When you will not show anything, then line mein khade raho. Then you're not going to get a license to play carom. Sort out ho gaya, life has become little easy. Bio positive for pneumonia gets a license to play carom. Bio negative for viridans, therefore line mein khade raho. Keep standing in the line. That is how you learn it. Now let's take it up. Now actually your chapter is done, but now I'm going to take it up in a little bit detail. When I say Streptococcus viridans, do you know viridans is not one organism. Viridans is a group. So there is something known as Streptococcus viridans group that you have to know, which includes Streptococcus mitis. It includes Streptococcus mutans. This is the one that causes mutants mouth. Mouth में क्या कराएगा? Dental caries. So please remember, mutants is the one that is going to stick to the teeth and that is going to go in the mouth and cause dental caries. What does sanguis cause? Sanguis is important for prosthetic heart valve endocarditis. So sanguis is going to result in the prosthetic heart valve endocarditis. What is this salivarius? Go back to your general microbiology I have taught you. Salivarius is that organism that can have both capsule and slime layer and also the longest chains it's going to have. So please remember, we always say that either a bacteria has only capsule या only slime layer. Salivarius says कि सब कुछ होगा. I will have capsule also and slime layer in the same one. Most important question that you get over here, let me remind you again, mutants causing dental caries. Very, very important. That is the story of Streptococcus viridans. Rest you know, chains में होगा and biodata में सब कुछ no, no, no. No bile solubility, no inulin fermentation, no optochin sensitivity. सब कुछ no, no, no करेगा. Now I go on to Streptococcus pneumoniae का details and you already know the details. I'm just going to tell you a little bit extra. First, I'll start with the virulence factors. Please note that the virulence factors of Streptococcus pneumoniae or pneumococcus, the most important is this capsular polysaccharide. And this is antigenic. Whenever there is something antigenic means there are going to be more than 90, actually more than 97 also now, but more than 90 serotypes which are known on the basis of this capsular polysaccharide. If you want to demonstrate it, you can do something called a Quellung reaction, and this is just not for the capsule of pneumococcus, this is for the capsule of everything. What is this gonna be? What is Quellung reaction? So pehle to I'll always give you one mnemonic na ki life easy ho jaye. Quellung, swelling. Rhyme kar raha hai? Quellung and swelling. So remember, if this is a bacteria and you say that this bacteria is capsulated, ma'am, this has a capsule. Capsule means it's gonna have an antigen around it, hai na? What will you do? You will add antisera or some antibody. Now tell me, if antigen is there and you add some antisera, is there gonna be a reaction? Yes, so that is what happens. There is an antigen-antibody reaction which results in swelling of the capsule. It results in swelling of the capsule. So that is how I've learnt it. Quellung is swelling. Okay? Quellung is the swelling wala reaction. But other than that, for the capsule, you can do PCR, you can do ELISA, you can do, because antigen hai na, antigen ke liye you can do PCR, ELISA, latex agglutination test. You can do so many other things also, which is, I mean, that is for every antigen you can do, so nothing to worry. But the question aega will be Quellung for swelling. Okay, that is the first virulence factor. Other than that, it has something called pneumolysine. Lot of lysins I'm going to tell you. It's going to have pneumolysine, it is going to have autolysine, it is going to have hemolysine. पहले तो hemolysin और streptolysine, man, ये तो suddenly I have read this somewhere else. I had read this hemolysin or streptolysine in Streptococcus also, Streptococcus pyogenes also. So ultimately I realized that ये जो hemolysins होते हैं, जो streptolysins होते हैं, I will be reading them in a lot of places. So please remember, this clubs is only to show you clubbing, because that shows you that clubs wala jo organ. This is again not very important as a mnemonic. If you can learn it, if your mind allows you to absorb it, theek hai, otherwise you can skip it also. Clostridium tetani and Clostridium perfringens. So do Clostridium, Listeria, Bacillus cereus and Streptococcus pneumoniae. You will realize that their hemolysins are very similar. So remember, clubs mein everyone has a vibe. If you go clubbing, then your vibe matches with someone, then you go clubbing and partying with that person. So clubs में सबका ये streptolysine vibe match हो रहा है. Clostridium tetani perfringens, Bacillus cereus, Listeria and Streptococcus pneumoniae. Okay, now out of these, please note, if I first ask you that, okay, I will be going into all of these details, but first tell me the clinical features of Streptococcus pneumoniae will of course all cause pneumonia. So community acquired pneumonia to of course is going to happen. But other things also of the ENT shall happen, sinusitis will happen, otitis media will happen. So this is to understood, because pneumonia word only tells me lungs and ENT wala pura tract. But meningitis, yes, across all age groups. Across all age groups, this is definitely gonna be the most common cause of meningitis. I am not saying meningitis in neonates or 20-year-old. If no age is mentioned, then this becomes the most common out of them all, right? Okay, so now what do I know in terms of the diagnosis? Can you tell me? Because I think you know. What is going to be the organism's shape? It's going to be the lanceolate shape. It's got a lens, hai na? And I can see it's got a capsule also. That is why that Quellung reaction was coming. After that, what kind of colonies does it have? I have again told you it licensed to play carom. So either carom coin. So do you remember how carom used to look like? It used to look like carom coin. We have all played it in our childhood. I still like to play it now. It has elevated corners and it has a depressed center. It has elevated periphery and a depressed center. That something is getting depressed. Draught mein ja raha hai. That is why it's known as Draughtsman colonies. That is why it's referred to as Draughtsman colony. So you will ask me, why is the center getting depressed? It's like killing your own self. Like we all know. Did I just tell you that one of the factors is gonna be what? One of the factors is autolysin, you know, autolysis. Yes, this bacteria is capable of doing autolysis. So please remember, autolysin is what kind of an enzyme? It's an amidase enzyme. That is what is depressing the center. वो खुद को eating up, खुद को destroying. That kind of a thing is happening over here. Yes, sorted. So licensed to play carom, lens shaped and carom coin colonies. What is the treatment gonna be? Of course, once again, the treatment is gonna be beta-lactams, no doubt about it. And the resistance hoga, so we'll go in for third generation cephalosporins. But how does the resistance occur? Ma'am, beta-lactams means penicillin. Whenever you're saying resistance to penicillin is happening, how is this resistance happening? That binding protein, that penicillin binding protein must be getting altered. वो तो हर जगह है. Whenever there is a resistance to beta lactams, the penicillin binding protein, whether it was in staph or whether it is here. But how is it getting transferred from one bacteria to the other? In Streptococcus, it is transformation. I hope you remember in Staphylococcus aureus, it was happening by what? It was happening by transduction followed by conjugation. That is what we had studied in Staphylococcus aureus. In Streptococcus, we are studying it is more commonly by transformation. Do you remember what was transformation? हवा से उठा लेना, picking it up from the air, just picking up something from the air, free DNA being picked up, that was transformation. That is what Streptococcus pneumoniae does. The only part of this that you are left with is, of course, going to be the vaccination. We have two vaccines, Pneumovax and Prevnar. So, which is the bigger name? Pneumovax is the bigger name. So, that is going to be the 23-valent polysaccharide vaccine. Prevnar is the chota name. So, that is going to be having only 13 valencies. Now, bigger name is obviously going to be given in bigger people. Chota name is going to be given in smaller people. So if you have to give a vaccine to people or kids who are below 2 years of age, you're going to give the chota wala Prevnar vaccine, which has 13 valencies, given below 2 years of age. What you will never give below 2 years of age is that big wala name. That big wala name means Pneumovax. That is going to have 23 valencies. That you're never ever going to give to people less than 2 years of age. And once you give that, that gives you an immunity for 5 years. So big logon ko do, big immunity karo. That is what you will study. So repeating once again, the bigger name Pneumovax has big valencies, 23 valencies. You give to big people for big immunity, more than 5-year immunity, and give to people above 2 years. Prevnar chota vaccine having less valency, 13 valency, below 2 years of age you will be giving. And I hope you all remember there is 2 months, then 4 months, then 6 months. There are 3 doses of Prevnar that have to be given, 2 months, 4 months, 6 months, and then there also has to be a booster around 12 to 15 months. I'm sure all of this you have studied in your PSM very well, but yeah, just for your repeat, I have got you 2 months, then 4 months, then 6 months, and then a booster at 12 to 15 months. Sorted? Streptococcus pneumoniae. So VP ho gaya, viridans ho gaya, pneumococcus ho gaya, alpha hemolysis also done. So which is the last family that we are left with? And that is going to be the gamma hemolysis. Now, over here, first I want all of you to get reminded, gamma was what? Gamma was no hemolysis at all, right? This is a little confusing, to dhyan se sunna. Ideally, I said gamma hemolysis as what? Gamma hemolysis as one bacteria called Enterococcus, right? Which is fine, which is the real thing. But also note that in that beta hemolytic, when I was doing group A, group B, group C, group D, there is a group D which sometimes can show you gamma hemolysis. Although it is belonging to that grouping of beta hemolytic variety, it is beta hemolytic, but sometimes it can show you gamma hemolysis. So can I say gamma hemolysis can either be shown by the Enterococcus family, or there is a chota sa non-enterococcal family also that can show you gamma hemolysis. I will come back to this table. This is not the right time to teach you this table. I want to first teach you the main member, Enterococcus. Once you are done with all of this, the other family to becomes very easy. So Enterococcus padh ke वापस आते हैं, right? Now when I talk about Enterococcus, let me teach you some basics about Enterococcus from the name. This is one of my favorite mnemonics because everything from Entero is going to come up in front of you. So I've got you all the alphabets in front of you. So E ko you're going to convert it into a B, and not like this. You're going to convert it E like this now. So you're going to convert it into a B because this is a spectacle shaped nucleus or spectacle shaped organism. This is a spectacle shaped gram-positive cocci. Acha, did you notice? I don't want to get this edited because sometimes mistakes are also good. I just said spectacle shaped nucleus by mistake, na? So where do you see a spectacle shaped nucleus in pathology? Which cell is an orange looking cell with spectacle shaped nucleus? It's an eosinophil. So as I said, sometimes mistakes also help us revising. So that was a spectacle shaped nucleus. This is a spectacle shaped gram-positive cocci. Okay, then after that, what is N? Is it motile? No, I did not study any motility over here. Is it to do with anything to do with sporing? No, there is no sporing also that I see over here. And what I see over here is N, another N, NaCl. It will survive in NaCl 6.5%. Not only is it tolerant to that, guys, it is tolerant to one more thing, and that is heat. T for heat tolerant also. Okay. Then I come to E. E ka to rule hai. Jahan jahan E hai, convert it into a B. So it is able to survive 40% bile. It is resistant to 40% bile. Ma'am, it can grow in 40% bile. So why don't you use a culture media that has bile in it? That is why we use the bile esculin azide agar. What we use over here is the famous bile esculin, azide, agar, because now I will be able to know that bile mein to it can survive. And esculin, it breaks, it causes esculin hydrolysis. So basically it can survive in bile, it can break esculin. So bile, esculin, azide, agar will give it what color? Another B. It's gonna get a black color. So simple. Now the bees tell me that it is resistant to bile, it is gonna grow in the bile agar and it is gonna get a black color. Now moving on to the last, the R. R is gonna be a reaction. It is PYR test positive. It is PYR test positive. So repeating, with the E in the starting, you had started, every time E comes, you convert it into a B. So B matlab spectacles jaisa lag raha hai. Non-motile, non-sporing and NaCl 6.5%. Heat tolerant, bile, bile, esculin, azide, agar, black color. PYR test positive. Have a look at the picture so that I can now tell you the clinicals also. Firstly, blood agar. Has blood agar broken? No, blood agar is totally the same. So I say that on blood agar, there is no hemolysis. It has not been broken. That is why I call it gamma hemolysis. Hai na? Look at the shape. I told you spectacle shaped hoga. There are groups of two that I'm seeing. Spectacle shaped is what you're noticing. Bilkul correct. So spectacle shaped gram positive cocci. And next you see is bile, esculin, azide. Where what color tells you positivity? If you get a black color, this means it has grown. If you don't get a black color, means it has not grown. So these are the pictures. So pretty much done with all of this. And that word entero, dekho entero, ENNNTER. Entero tells me everything about entero except for its clinical features. So remember, there is Enterococcus faecalis and Enterococcus faecium, out of which faecalis is more common. And this usually causes either UTI, and which kind of UTI? CAUTI. CAUTI means catheter-associated UTI. Catheter-associated urinary tract infection, or it can cause widespread infection, that is septicemia. Matlab, Enterococcus ke saath you can have entire septicemia can occur, and of course you can have the catheter associated UTI. So you're done with this. You're also done with the entire mnemonic. Of course, you're only left with the treatment part. Ab treatment to wahi chalega. There's going to be penicillin, beta-lactams. If there is resistance to penicillin, what do you give? You give vancomycin. But now I hope you remember there is a resistance which I've been telling you. Like same story went on in staph na. Guys, please revise the story of Staphylococcus aureus with me. First, you were giving penicillin. When penicillin was resistant, you were giving methicillin. When methicillin is resistant, you are giving vancomycin. Yahan par bhi you are giving vancomycin, but vancomycin resistant staph aureus is also known na. Similarly over here, vancomycin resistance enterococcus is also known, and the pathogenesis is the same. How did vancomycin resistant staph aureus occur? Because ma'am name हमने address change कर लिया था. D-ALA was changed to D-ALA D-lactate or D-serine. Remember this story? I hope you guys remember this story. This is very, very important. So remember, vancomycin resistant enterococcus is also because of the same. D-ALA has changed to D-ALA D-serine or to D-lactate. It has basically changed. The bacteria has changed its address. That is why vancomycin is not able to act. And in that situation, we are going to go ahead and give linezolid. So yes, that is the resistance ka treatment. But of course, nowadays it all depends on antibiotic sensitivity. Before I end this chapter, it's time to differentiate what I told you. I'll come back to. Now can I say gamma hemolysis or no hemolysis is a feature of Enterococcus, which definitely grows on bile, esculin, azide, agar, which definitely survives NaCl, which is PYR test positive, and is going to contain Enterococcus faecalis. All this story I know. Iska opposite karo. Because gamma hemolysis is shown by one chota sa family of that beta hemolysis, that is group D, which has nothing to do with Enterococcus. But why are we studying it together? Because it can show you the same properties of bile. Sirf wo bile wala property is the same. Rest it does not show me any tolerance to NaCl. Rest it does not show me any PYR test positive. It is only similar in the format that ek to dono show you gamma hemolysis and both of them are going to be showing you bile reaction. The organism that comes under it, this is important only for INICT, is going to be Streptococcus gallolyticus. This has been implicated in what? This has been implicated in the causation of colorectal cancer, polyps, sepsis, endocarditis, to say the least. But what you're going to get a question on is definitely this. Indirect question. Colorectal cancer or polyps have been associated with which of the bacterial infection. Remember this group D, non-enterococcal, but that's the only thing you have to know, that is polyps and CRC with Streptococcus galoleticus. Yes. Now, before you leave, you have finished all of it. I'll quickly revise with you. Alpha hemolytic, beta hemolytic, gamma hemolytic. Alpha में Streptococcus viridans and pneumoniae. Beta had group A beta hemolytic Streptococcus, that is pyogenes. Group B beta hemolytic Streptococcus, where you had a gala time, agalactic, gala time in the camp test positive. And gamma में the main one is going to be enterococcus, where the mnemonic is only enter, right? So are you ready for some questions? Question number 1. All of the following are characteristics of Streptococcus pneumoniae except, remember pneumoniae, this was saying yes, yes, yes to everything. तो पहले बताओ, is it biodata में सब कुछ? Yes, yes. Is it bile soluble? Yes. Is it inulin fermentation? Yes. Is it going to show you optochin sensitivity? Yes. What does it not show you? Catalase. This I didn't have to think much because Streptococcus anyway is not catalase positive. Streptococcus is going to be catalase negative. Okay. Let's move on to a little lengthy question. You have an 8-year-old boy who's brought to the emergency department with a 3-day history of fever, 102 degree Fahrenheit. There's abdominal pain. There is also pain in the right knee, right elbow, and there was a sore throat and a rash. So sore throat sunte hi Streptococcus pyogenes definitely comes to my mind. Joint involvement is also there. Abdominal involvement is also there. And I say that amoxicillin was prescribed, but the mother did not give the prescription. On physical examination, his temperature is elevated, heart rate 96, BP 100/60, and cardiac examination shows a pan-systolic murmur at the apex. There's a cardiac involvement. Okay, then right elbow is tender because joint involvement tha. Lab test shows C-reactive protein, WBC elevated. Come on guys, C-reactive protein is also elevated, and ECG shows a prolonged PR interval. What is all this? Jones criteria pura ho raha hai. This is a case of rheumatic heart disease. I hope you guys have studied this with me in pathology also. Medicine may be of course pada hai. So what am I talking about? Of course, rheumatic heart disease means it is Streptococcus pyogenes. And tell me, is Streptococcus pyogenes anything to do with catalase and coagulase? No. Is it? Tell me, Streptococcus pyogenes, is it gonna be bacitracin sensitive? Yes, and that is the answer. देखो optochin नहीं होगा, optochin वो bio में चला गया था ना, bio for pneumonia. This is bacitracin sensitive, and that is the answer over here. Yes, with that we definitely wrap up our entire discussion of Streptococcus, and these two, Staph and Strepto, were the most lengthiest families that you have. Now thankfully bacteriology going forward is going to be shorter.